Look at that mark for a second. Round, dark purple, almost perfectly circular. If you have ever done cupping, you have seen this exact mark on your own skin and thought, good, it worked. That is the moment I want to slow down. Because that mark is not proof that anything left your body. It is proof that something happened to your blood vessels. And once you are past 50, that difference is not just interesting. It changes whether cupping is a relaxing habit or a genuine risk. Before I go further, if you are new here, welcome. This channel is built for one simple reason: to tell you the things about your health that usually get explained too late, or not at all. If that sounds useful to you, sticking around and joining this community helps more people over 50 find this information before they need it the hard way, not after. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and for the last 15 years, I have worked mainly with men and women over 50. Cupping comes up in my office more than you would think, usually from a patient who loves it, and occasionally from a patient who is in my office because of it. So today, I want to give you the real picture, not the version you hear from a wellness influencer, and not a lecture telling you to stop. So tell me something first. Have you actually tried cupping yourself? Or is this because someone you trust keeps telling you that you should? Drop that in the comments because it changes which part of today matters most to you. Here is what actually happens when that cup goes on your skin. The cup creates negative pressure, which is just a scientific way of saying it pulls. That pull draws your skin and the tissue underneath it upward into the cup. And directly beneath your skin sit thousands of tiny blood vessels called capillaries, thinner than a human hair. When that pulling force is strong enough, some of those capillaries rupture. Not tear open dramatically, just rupture at a microscopic level, and blood leaks out of them into the surrounding tissue. That trapped blood under the skin is the mark you are looking at. In medicine, we sometimes call these petechiae when they are small and pinpoint, or ecchymosis when they pool into that larger circular bruise you recognize from cupping. Either way, it is blood pooling under intact skin. It is not toxins rising to the surface. There is no biological mechanism by which suction pulls metabolic waste out through unbroken skin. What you are seeing is a controlled bruise shaped like a circle because the cup is round. This is the myth I want to clear up directly. Most people believe the darker the mark, the more toxins were pulled out, and the more the treatment worked. That belief is not true, and honestly, it is backwards. A darker mark usually just means more capillaries ruptured, which often means either the suction was stronger, it was left on longer, or your blood vessels were simply more fragile that day. It is not a scorecard for how much your body needed the treatment. Reality is that cupping's real, evidence-supported effects come from something completely different. Research consistently links cupping to a temporary increase in local blood flow and to a nervous system response similar to what happens with massage, where pressure on the skin can reduce the perception of pain for a period of time. That is genuinely useful for some people, but it has nothing to do with the color of the mark it leaves behind. I want you to do something with me right now. Wherever you are watching this, take 2 fingers and gently pinch the skin on the back of your hand or your forearm. Feel how it moves and how quickly it settles back down. Now think about how that skin looked 10 years ago. If it takes a little longer to settle, if you can see more of the blood vessels underneath than you used to, that is completely normal, and it tells you something important about how your skin will respond to suction. Here is the part that makes this specifically a 50 and over conversation. Starting around your 40s and continuing steadily after that, your skin's outer protective layer thins, and the collagen that gives your skin its cushioning strength declines by roughly 1% every year. Your blood vessels also become more fragile, partly from that same collagen loss, and partly from decades of sun exposure adding up. The result is skin that bruises more easily, heals more slowly, and reacts more strongly to the exact same amount of suction that a 30-year-old would barely notice the next day. Picture 2 identical rubber bands, one brand new and flexible, one that has sat in a drawer for 20 years and gone slightly brittle. Pull them with the same force, and the older one is far more likely to react badly, even though nothing about how you pulled it changed. That is your skin at 50 compared to your skin at 25, under the exact same cup. Age alone is not the whole story, though. There are 3 specific things I check for before I would ever tell a patient cupping is fine for them. The first is blood-thinning medication. If you take aspirin daily, warfarin, or one of the newer blood thinners like apixaban or rivaroxaban, cupping can turn a normal temporary mark into a much larger area of bleeding under the skin because the exact mechanism that stops your blood from clotting properly also stops it from containing that pooled blood the way it normally would. The second is diabetes, specifically if your blood sugar control has been inconsistent, because diabetes can slow how quickly your skin repairs itself. And a cupping mark that would fade in a week for most people can take considerably longer, and in rare cases break down into a small wound. The third is varicose veins or any diagnosed circulation problem in the legs, where added suction on already weakened vein walls is simply not worth the risk. I see this pattern constantly in practice. A patient comes in already on a blood thinner for a heart condition, feeling good about their weekly cupping session, and what should have been a small circular mark has spread into a bruise the size of a hand across their shoulder. They are not doing anything wrong on purpose. Nobody sat them down and connected their prescription to their wellness routine. That gap between what your pharmacist tells you and what your massage therapist tells you is exactly where problems like this live. Think about a kitchen sponge that has been squeezed and dried out over and over for years. Squeeze a brand new sponge and it springs right back into shape almost instantly. Squeeze that same sponge after years of use and it takes longer, and sometimes it stays a little compressed. Your blood vessel walls behave in a similar way after decades of normal wear, sun exposure, and the natural decline in collagen I mentioned earlier. They still work perfectly well for everyday life. They simply do not spring back from pressure quite as quickly as they once did. And that is exactly why the same cupping session that barely marks a younger person can leave a much deeper impression on you. Here is something practical nobody tells you. Even without any of those 3 risk factors, there are simply better and worse days to do this. If you are already dehydrated, if you had a poor night of sleep, or if you bruise unusually easily that week for any reason, that is a perfectly reasonable day to skip the session rather than push through it. Cupping is not an emergency treatment. There is no downside to waiting until your body is in a slightly better place to handle it. One small habit I recommend to almost every patient of mine, regardless of what treatment we are discussing, is to simply ask your pharmacist directly whether anything on your current medication list affects bruising or bleeding. Pharmacists see this exact interaction constantly, often more than a busy physician does in a short visit, and most people never think to ask them a question that specific. It takes about 30 seconds at the counter, and it can save you from finding out the hard way. One more thing worth knowing honestly. There are 2 common methods. Fire cupping, where a flame briefly burns inside the cup to create the suction before it is placed on skin, and pump cupping, using a small hand pump to create that same suction without any flame at all. Fire cupping carries a real, if uncommon, burn risk if it is not handled by someone properly trained, and that risk matters more on skin that already heals more slowly. Pump cupping avoids that specific risk entirely, which is why it is generally the more forgiving option for anyone over 50 who wants to try this at home or with a newer practitioner. There is also a version of this called wet cupping, sometimes referred to as hijama, where a very small, controlled break is made in the skin before the cup is applied, so that a small amount of blood is drawn out along with the suction. That is a genuinely different situation, because now you are dealing with an actual open wound, not just intact skin under pressure. Infection risk becomes real if the tools are not properly sterilized, and healing that small wound takes meaningfully longer once you are past 50, especially if your immune response has slowed with age or if you manage a condition like diabetes. If you are drawn to that version specifically, the practitioner's sterilization practices are not optional details. They are the entire safety of the procedure. Now, here is something I do not think enough people say out loud. The healthcare and wellness world is not built to warn you about this kind of thing before it happens. There is no billing code for a doctor to sit with you and cross-reference your cupping habit against your prescription list. Your cardiologist manages your heart. Your massage therapist manages your muscles. Neither of them is trained or frankly paid to connect those two dots for you, so that job quietly falls to you, and until today, probably nobody handed you the information to do it. If any part of this made you sit up a little straighter, this is exactly the moment to share it with the person in your life who does cupping every week and swears by it. They are not wrong to like it. They just deserve to know what that mark actually means. And if you have not subscribed yet, this is the kind of thing this channel exists for, catching the detail before it becomes a problem instead of after. A single share to the right person, someone who does this every week without knowing any of this, genuinely matters more than any number on a screen. I do want to ask you one more thing, and I ask this in almost every video because it genuinely changes what I recommend. How old are you? Not for any other reason than this. The advice that is exactly right for a 60-year-old with no other health conditions can be too cautious or not cautious enough for someone in their late 70s managing 3 medications. Telling me your age in the comments helps me speak directly to you instead of to some imagined average viewer, and it shapes what topics I choose to cover next. And honestly, it also helps me know who I am really talking to every time I sit down to make one of these. Here is something that might surprise you. In several dermatology case reviews, the single most common cupping-related visit to a doctor was not from the mark itself. It was from someone who kept the cups on far longer than recommended, chasing a darker mark because they believed darker meant better. The injury did not come from cupping. It came from a belief about cupping. Here is a pattern I want you to notice in yourself because I see it constantly. Someone tries cupping for shoulder or lower back tension. It genuinely feels better for a day or two. Then the tension creeps back, the same way it always does with muscular pain. So the next session goes a little longer, or the cup sits a little tighter, chasing that same relief. Weeks later, the marks are darker, they are taking longer to fade, and the underlying tension is exactly where it started. That cycle is not a personal failure. It is what happens when a temporary mechanical effect gets mistaken for a lasting fix. I am not telling you to abandon cupping. Plenty of my patients use it sensibly and get real, if temporary, relief from muscle tension. What I want is for you to use it with open eyes instead of blind trust. So here is a short, honest plan if you want to keep using this. The first step is this. If you take any blood-thinning medication, including daily aspirin, talk to your doctor before your next session and mention it specifically, because most people never think to bring this up. The second step is to choose pump cupping over fire cupping once you are past 50, simply because it removes one entire category of risk. The third step is to ask whoever performs your cupping to use lower suction and shorter time, somewhere around 5 to 7 minutes, rather than the 15 or 20 minutes sometimes used on younger clients. The fourth step is to stop chasing a darker mark as a sign of success, and instead judge the session by how your muscle actually feels the next day. The fifth step is to check your skin the day after, and if a mark is spreading, unusually painful, or has not started fading within about a week, treat that as a reason to call your doctor rather than wait it out. The sixth step, if you have diabetes, is to have your blood sugar reasonably well managed before you start any regular cupping routine, since that healing speed genuinely matters here. Here is the moment most people skip past. The first time you follow all of this and your session feels gentler, with a lighter mark and less dramatic bruising, some part of you may quietly think it did not work as well this time. That feeling is not a sign you did it wrong. That feeling is the exact moment to trust the process instead of the color of your skin. If this changed how you think about something you or someone you love already does regularly, I would love to hear it. Tell me your own experience with cupping in the comments, whether it has been great for you or whether something like this happened to you, and let me know what you would like me to cover next. This channel only gets better with what you bring to it. Some of the best topics I have covered came directly from a comment someone left on a video like this one. So if there is a treatment, a supplement, or a habit you have heard is good for you after 50, and you are not entirely sure it holds up, tell me. and it may become the very next video. I also want to be fair to cupping itself for a moment, because it is easy for a video like this to sound like a warning label and nothing else. For the right person, without those specific risk factors, using it sensibly, cupping can be a genuinely pleasant part of managing everyday muscle tension. My goal was never to take that away from you. It was to make sure you are choosing it with the same information your doctor would want you to have, instead of the version that only shows up on video thumbnails. Before you go, here is your honest, doable plan one more time, all in order. Number 1, check with your doctor first if you are on any blood thinner. Number 2, choose pump cupping over fire cupping. Number 3, ask for lower suction and a shorter session time. Number 4, stop judging the treatment by how dark the mark is. Number 5, watch your skin the next day and call your doctor if anything looks unusual. Number 6, keep your blood sugar steady if you live with diabetes before making this a regular habit. Thank you for spending this time with me today. If this is the kind of thing that helps you feel a little more in control of your own health, staying close to this channel means you will not miss the next piece of information exactly like this one before you need it rather than after. And if today is the day you decide cupping simply is not worth the extra caution for you personally, that is a completely reasonable choice too. There is no prize for pushing through a treatment that no longer feels worth the trade-off, and there are other ways to ease muscle tension that carry far less risk as we get older. And one honest note before we close. Everything in this video is meant to help you ask better questions, not to replace an actual conversation with your own doctor, who knows your health, your medications, and your history far better than any video ever could. Take care of yourself, and I will see you in the next one.